So, let's talk about investigation results. Sometimes, some people come with their results, you know, and they tell you, please look at these results and write treatment for me. This is someone you've not seen before and you don't have a knowledge of why he was given the test to do, and you don't have other information other than the results that you are presented with. Sometimes you receive call on the phone from friends, family members, and other acquaintances, and they tell you, please, doc, I have a test. I forwarded it to you on WhatsApp. Please look at it and advise me. And oftentimes they don't provide information about who owns the test, what was done, and stuff like that. People expect that you just look at the tests and just know what the problem is. So let me talk a little about tests. Now, a test is like when you have an issue, when there is an issue, right? And you are listening to the story, and you listen to one part of the story. If you listen to one part or one side of a story, you're not going to get the full picture. You're not going to make a good judgment of what has happened. So a test tells a story. Now, if you have done several tests, each of them tells part of the story. For example, you did a urine test, it tells a urine story, right? You did a blood test, several blood tests, each tells a story. And you did an X-ray, a scan, each tells a story. But the story is not complete because each test has a context. The context is the information about who did that test. So we need information about the person who did the test, the age and gender of that person, and a little bit history of what the problem is. What are his complaints? What did he complain about? And what has been happening to him? What is the history? What kind of treatment has he received in the past? And what other complaints does he have? Does he have allergies? Does he have chronic medical conditions? If he has been to other hospitals in the past, what happened? What investigations were done in the past? Did he have surgery? All of those stories about what the person went through and what has been done in the past, they all form part of this story. So when you see an investigation result, it's telling one part of the story. You need to hear the other parts of the story. You need to put together all the parts of the story for you to make a better judgment of what is going on with that patient. You don't rely on one aspect of the story. And this is important because sometimes when you are listening to a story, right, and you hear one aspect of the story and like, it can't be now. It can't be. And you now listen to other aspects of the story and it now begin to make sense. And you now begin to question what that other part of the story was about. What do I mean by this? If I see a patient, for example, I've asked the patient what the symptoms are, what his history is, and I've examined the patient and I gave the patient investigation results. Now, before giving the investigation results, I already have my suspicion. I already have what I'm thinking about, the possible diagnosis, right? And when the results come back, if the results go against all my suspicion, I will not be wondering, could I be wrong all along? Or is there a problem with this test? So that story, that test, it's possible there's a problem with the test. There are situations whereby errors could be made. We are all humans. And so there could be error in the lab. or in the radiology department, a mix-up could have happened. That's one possibility. Another possibility is that the test is correct, and that you have to go back and look at the story, the other parts of the story, and see how you can corroborate it. Another thing is that there is room for repeating investigations. So if you do a test and it's, it goes against what you were expecting, there is room for you to say, okay, go and do this investigation again, or go to another center and repeat the test. Let's be sure that what this test is telling us is actually the case. One other thing that we often say is that we don't treat tests or investigation results. We treat patients. We treat people. It's patients, it's people that have these results. And so when we are looking at that result, we have to look at the person, the individual that has the result. We have to look at the story, as much of the story as we can, so that when we are now making a decision, we are taking a decision based on an informed background, that we have gotten the information that we want. And so, when next you present a result to a doctor, please remember that you have to provide context. You have to give the doctor information. And please don't withhold information thinking that, the doctor will just look at the test and know what to do. No. The story is important. And one more thing, you notice that when we fill out investigation forms, we put your names, your identity, and then we put your age, we put your gender, and we tell the person what we are thinking of. We'll tell the lab, this is what we are suspecting. We'll tell the radiologist, we'll tell whoever is doing the investigation, this is what we are thinking of. So that as they work on the investigations you have requested, they will keep in mind those information that you have provided them with. And such, they will make better informed decision. There was a time someone gave an investigation result, abdominal ultrasound, to a patient. And the health personnel did not provide any information about what the patient complained about and what's the possible diagnosis. So when I saw the investigation results and I approached the person and said, this place, you're supposed to put information about what you are suspecting, so that when they go to do the scan, the person doing the scan will know what to focus on. And the person said, no, I don't want to provide information. You'll be giving them expo. That the implication was that he thinks that, if I write, I'm suspecting this person has acute appendicitis, when they do the scan, they are going to see acute appendicitis. That's not really the case. Yes, we may have some issues sometimes with the quality of some of the results that we get, but more often than not, the information you provide will help to guide the person that is conducting the test, so as to know where to focus. Take, for example, abdominopelvic scan. There are a lot of things in the abdomen. Many things, there are many scenarios, many possibilities, many diagnoses. So, but when you give information, for example, you say this person has hepatitis B, he has a liver disease, right? So they know where to focus. If you are putting information that you're suspecting a kidney disease, they know where to focus. If it's a female and she's having some lower abdominal pain, she's having discharge, and you indicate that, they also know where to focus, so that they too will get a better story, and they would give the results, the investigations result that will come out will be more detailed and will be more helpful to you, to the patient, and to you, the physician, who is making the request for such investigation. So in summary, let me state that they test one side of the story. You need the whole complete picture. You have to listen to the other side of the story. Every test has a context. Context is the background information about the person who has that test. And we don't treat tests, we treat patients, because every test has a story behind it, and we have to get that complete story so that we make a well-informed and better decisions.